Good afternoon, everyone. Hope everyone enjoyed that music. My name is Juan Jimenez. I'm here with Phoenix House and the prevention team with Claudia, Julia, and Steven, and our clinical trainer, Morgan Wallace. And today we bring this special topic on some signs of commonly abused drugs. And this topic is going to link a variety of drugs that we find in the streets. Some of these you find in schools, and some of these, surprisingly, you find in your cupboards, in your kitchen, medication that's used for medication management. So, again, my name is Juan Jimenez. We are going to be recording this presentation, and at the end, we will pause the presentation to have a Q&A, a moment where you could ask questions, any concerns, or even if you're looking for services. So we will stop the presentation then, and you're able to ask through the chat room or unmuting yourself. So let's begin. So some of the topics that we're going to touch on today: alcohol and warning signs, marijuana warning signs, methamphetamine, prescription pills, hotline numbers that are very important to find services. Sometimes, there's still individuals that technology is still a obstacle and a barrier. Phone numbers are sometimes just easier access to databases that are commonly updated, like SAMHSA. So we're going to begin with alcohol. We're going to have Steven present alcohol. Go ahead, Steven.
Thank you, Juan. Hello, everyone. So that's correct. We are going to be talking about alcohol. Give me 1 second while we go on to the next slide. Juan, can you just hit the next slide for me, please? Thank you, sir. Wonderful. So when talking about alcohol, one of the things is people drink to socialize, celebrate, and relax, right? As you guys can see in the picture back here, it's a group of individuals. They're having a few drinks and they're socializing. They're having a good time, right? This could be, they're either celebrating something after a long week of, stressful work. They got together and they hung out, right? Alcohol often has a strong effect on people, and throughout history, we've struggled to understand and manage alcohol's power. Why does alcohol cause us to act and feel differently? How much is too much? Why do some people become addicted while others do not? So these are all great questions, right? Definitely great questions. Alcohol's effects vary from person to person depending on a variety of factors. These could be including how much you drink, right? So how much an individual drinks, that could be a form of where the alcohol affects them. It is important to note, though, that it's not just celebrating, right? It's not just socializing. Individuals drink alcohol, so when there's a funeral, right? When there's depression is involved, when some of these things are happening where you've kind of hit rock bottom, like it could be going through a divorce, right? Or you just you lost your job, you've lost everything. Sometimes some individuals turn to alcohol in a sense. It's basically like it's their go-to, the thing that makes the pain go away, right? So these are some of the things, how often you drink, the person's age, their health status, and family history. These are all contributing factors to how alcohol would affect them. While drinking alcohol is itself not necessarily a problem, drinking too much can cause a range of consequences and increase your risk for a variety of problems. Go ahead and hit the next slide, Juan. Thank you. So this is hopping into alcohol and warning signs, right? So alcohol basically enters your bloodstream as soon as you take your first sip. So as soon as an individual takes their first sip of whatever it is, a mixed drink, a beer, a shot, things like that, it enters your bloodstream right away. And then alcohol's immediate effect can appear within about 10 minutes. As you drink, you increase your blood alcohol concentration, which is considered BAC, um, which is the amount of alcohol present in your bloodstream. The higher your BAC, the more impaired you become by alcohol's effects. I know we've all at some point have heard or seen, especially if we work in the field, um, the breathalyzer test, right? Or I know that I've driven by checkpoints very many times, and I've seen officers, even just driving on the freeway where they have someone pulled over and they have them breathing into the breathalyzer. They're trying to measure the alcohol content, right? So these are some of the effects that, obviously alcohol can include. Reduce inhibitions, right? Slurred speech, motor impairment. As you guys can see the picture in the background, that's basically what it would look like if you were driving and you were under the influence. Um, I cannot imagine driving that way. I understand, when I was looking for all this information and I started seeing all these pictures pop up, I understand why individuals get into car accidents, get pulled over, can't drive straight. I mean, it's you can barely make out anything out of this picture. And I can only imagine what it's like, if an individual is driving under the influence. Confusion, memory problems, concentration problems, comas, right? Breathing problems, and then the worst one, ultimately death, or possibly, injuring or hurting someone else. So these are all effects that come from alcohol. Um, Definitely something to think about, especially looking at this picture. It's you wonder why individuals would even think about getting behind a vehicle when you're looking at the street and this is what you're looking at. I just wanted to give you guys a visual because it stuck out to me on what it does to you. Go on to the next slide, Juan. So alcohol and its risk. So these are some of the risk of drinking can include car crashes and other accidents like DUIs, right? So you guys can see the picture in the background. This was an article of an individual who decided to get behind the road, behind the vehicle, or behind the steering wheel, I'm sorry, in a vehicle. And unfortunately, he was pulled over. They conducted a DUI exam on him, and it ended up turning out that he was under the influence, and he ended up going to jail. They say the average cost of a DUI is somewhere around $10,000, with your car being impounded, having to stay on a lot for 30 days, with going, obviously getting arrested, um, everything else that comes with that. I know a few individuals um, who have had DUIs, and they tell me, all these things of what they have to do now. It's either they put a machine in your car, and you have to breathe into it every 15 minutes or whenever you turn the vehicle on, to all these other things that they have to do with their insurance policies now, getting an SR22, things like that, and above all, I know we've heard at some point, sadly, accidents of individuals driving either on the wrong way, um, different things that have happened where individuals sadly have passed away. They might have not been drinking, but they were just at the wrong place at the wrong time driving, and someone who was under the influence ended up, hitting them, and they passed away. So these are some of the things. Risky behavior, right? The DUI, car crashes, and other accidents. ties in with this, right? Risky behavior, you in a sense, you don't care what happens, right? You don't care if you get pulled over, you're still going to get in the car, you're still going to drive home or wherever it is you're going. This could fall with, violence, right? Violent behavior, suicide and homicide, um, because you're under the influence. So people who drink too much over a long period of time may experience alcohol's longer term effects. These can include alcohol use disorder, health problems, right? It's basically cardiomyopathy, stretching and dropping of heart muscles, arrhythmias, irregular heartbeat, stroke, high blood pressure, fatty liver, alcoholic hepatitis, fibrosis, and cirrhosis. Some of these things are like life changing. They're definitely, well, I mean, all of them are in a sense, but some of these things you have to continue to go to the doctor. You can't just take medication. If you experience a stroke, there might be rehab behind that, but eventually, like, you might be able to go home, right? High blood pressure, they might tell you, hey, you need to stop drinking, you need to eat healthier, here's some medication, you know here's some classes, here's some things that we can do for you, right? But when you talk about cirrhosis and fibrosis, alcoholic hepatitis, like, some of these things, like, you have to have medical procedures done maybe 2 to 3 times a week, before things get worse. And then, obviously, one of the bigger things is increased risk for certain cancers. There's a long list of certain cancers that an individual can get because of alcohol, and its risk. So definitely something to think about, when you talk to a family member, when you talk to a friend, a patient, a client, when it comes to alcohol. It's also important to know, the risk factors, the when they're coming off of the alcohol, right? They have to have a medical detox done. And then, unfortunately, we medical detoxes aren't cheap. They're not covered by most insurance companies. There aren't very many options in LA County that I could think of, at least, where they provide free detox. I kind of referred somebody to a detox program recently, and they ended up telling them that they had to pay $3,500, and unfortunately that person didn't have that money, so it makes it very difficult when it comes to treatment as well, because they do have to go have a medical detox when it comes to alcohol.
Yeah, and Steven, you hit an important part when it comes to those detoxes, but also in the beginning when you were talking about DUIs. One thing I remember finding myself talking to a former client of Phoenix House and alcohol abuse is that this individual wanted to be a professional soccer player. He was pretty good. We have a soccer field at Phoenix House, and we used to go, at it. He was pretty quick and had the skills. We forget that the impacts could be professionally too. A DUI can stop someone from, being able to achieve their goal, their career goals. So definitely not only impacts the physical dangers of it, but also could be professionally and last and impact a lifelong
And
effects on that.
I know, I have family members and friends who are nurses, directors, who have some sort of position where they had to go to school for 6-10 years, before they got to where they're at, and now they're licensed, or they have something. If they ever get pulled over and get a DUI, I mean, it's most of the time, as far as like therapists and nurses go, chances are, there's going to be repercussions to that. And that might be you losing.
There's usually zero tolerance.
Yeah, that might be you losing your license, or not being able to practice medicine as a doctor, and I mean, we see it all the time with doctors operating under the influence, or whatever, a psychiatrist, or different things, so it's definitely something to think about.
All right, with this, we're going to be changing gears and introducing Claudia on marijuana and warning signs. Go ahead, Claudia.
Thank you, everyone. Give me 1 second. Okay, so marijuana and warning signs. So discussing marijuana is really important, especially when we talk about commonly abused drugs, because it is something that's out there and is commonly abused. Can we go to the next slide? Oh, got it. So what is marijuana, right? Before we jump into the warning signs, let's take the time to learn a little bit of, there you go. Let's take the time to learn really about what marijuana is and what it really does. Technically, marijuana is a plant that contains more than 500 chemicals. I know, that's a lot. It does include more than 100 compounds related to THC. So you might be asking, whoa, Claudia, what is THC? Basically, it's known as delta-9 tetrahydrocannabinol. And basically, it's the main psychoactive, mind-altering chemical in marijuana, which is responsible for most of the intoxicating effects that people seek. Basically, it's the chemical that provides the euphoria sensation and where users report to feel high. Next slide, please. Thank you. So there are a lot of physical warning signs for marijuana. I have listed many. The ones that I will be discussing today are some of the most common ones. As mentioned, marijuana is a commonly abused drug, right? And therefore it's beneficial to know these warning signs as they can help alert parents, providers, and overall the general public. Not to mention they can be warning signs that can help steer a possible drug user towards appropriate resources, right? Like treatment. Anywho, some of the short-term effects include the bloodshot eyes. As you can see in the picture to the right, it's what your eye, so to the right, it's what your eye usually looks like, right? And to the left is how someone's eye looks usually soon after they have used marijuana. So you can see it's red, it's pretty hazy. It doesn't really look as clear as it normally should. So some short-term warning signs can be, if you notice an increased appetite. I know that a lot of marijuana users usually call that as having what they call the munchies. Basically, if you notice that someone all of a sudden is craving food and is constantly munching on something, that's usually tends to be a warning sign when we talk about marijuana use and the possibility of somebody using marijuana. Another warning sign that I want to mention is slowed or impaired coordination. If you notice that someone is stumbling or isn't walking as they usually do, that's another warning sign. And this also comes with slurred, when they're talking. And let's say that you ask somebody a question and they might stutter or they might take a little longer to actually process it and answer. That's also another warning sign that is associated with marijuana use. And in the next slide, we're going to talk about the mental and behavioral warning signs. So when we discuss marijuana, it's really important to cover the mental and behavioral warning signs that are really associated with marijuana use. There are possible long-term health effects that can occur and can affect individuals in the long run. So people have reported that long-term drug use of long-term marijuana use has caused mood swings. And I have seen that myself. So when I used to work as a substance abuse counselor, I would notice that some of the clients would suffer from mood swings from not using the substance. And they would easily get irritated, and the mood swings were there. They were heavily impacting their life. So when I would ask them, hey, like, why are you all of a sudden reacting like this? This is just a question. Or your teacher only told you to just turn in your homework and you're getting upset. And it would always lead to a discussion where like, well, if I don't have this, usually like I get mad or something around that edge. But basically the mood swings were there. They do heavily impact marijuana users in the long run. So marijuana can also cause symptoms of mental health problems like psychosis, other known as hallucinations, the possibility for anxiety, depressions, and sleep disorders. Of course, with any drug comes the possibility for addiction. As scary as the term sounds, it's really something that's real. And unfortunately, with marijuana use, it does come with the possibility for developing addiction. I have listed other warning signs that are also important and that should be noted when we talk about marijuana use. But moving along, we do have Julian, who will be discussing methamphetamines. Go ahead, Julian.
Thanks, Claudia. So all of these slides are going to be available at the end of the presentation. If you guys have any questions about any of these, or if you want more warning signs, go ahead and type it into the chat. Without further ado, Juan, you could go on to the next slide, and we'll talk a little bit more about the warning signs of methamphetamine. So before we actually talk about the warning signs of methamphetamine, we have to first know what we're talking about. So what is methamphetamine? Well, methamphetamine is a powerful and highly addictive stimulant that affects the central nervous system. It's also known as meth, blue, ice, crystal, among many other terms. It takes the form of a white, odorless, and bitter tasting crystalline powder that also easily dissolves in water or alcohol. Methamphetamine comes in several forms and can be smoked, snorted, injected, or orally ingested. And the preferred method of using the drug varies by geographical location and has changed over time. So there's a lot of people maybe that were in LA, a lot of people like smoke meth, but maybe over in like Portland, they snort it or something like that. And that tends to change over time. It also tends to change within like the scope of use. So if someone is starting to use methamphetamine, they'll most likely smoke it. And then after that, they'll start, if they're still abusing methamphetamine and they feel like smoking it is no longer working, sometimes they'll just snort it. And then after that, if they feel like it's no longer working, sometimes they even inject it. And so it's a path of abuse, and it really depends like where someone is on that path and how long they've been using or abusing whatever substance that they're choosing to use. Juan, you could go ahead to the next slide. So some of the physical warning signs of someone using methamphetamine or abusing methamphetamine is that they'll have an increased attention and decreased fatigue. That also comes with increased activity and wakefulness. Typically, it's about 3 days. So if someone is up for about 3 or 4 days, they're most likely using and abusing methamphetamine. There's also a decreased appetite that lasts throughout those 3 or 4 days. So if someone used methamphetamine today, they probably wouldn't eat until Monday. They also probably wouldn't sleep until Monday. There's also a euphoria and rush that comes with the use of methamphetamine, but that euphoria and rush is more short-lived to right after someone uses it, or within the first maybe hour of use is when they feel the euphoria and the rush. They'll also feel an increased respiration. So you'll see someone maybe breathing really, really fast. You'll also see them maybe sort of like they look like they're panicking. They'll also have an irregular heart rate or a very rapid heart rate. So not just fast, but in an odd amount, like maybe 1, 2, 3, stop, 1, 2, 3. So because it's a stimulant, it affects the heart muscles in that way, where they're all off rhythm. There's also what's called hyperthermia, and we all know what hypothermia is, when someone maybe like is outside and is getting cold, or maybe they fell in like a lake that's frozen or something like that. But hyperthermia is sort of the opposite of that. So hyperthermia is when the body's temperature increases drastically, and that's similar to like having a fever. And what can happen there is that your body will almost start to like cook your brain, because your fever can get so high, and because your brain is so sensitive. Once it gets above a certain degree, then it'll actually start to affect you cognitively. So there might be confusion, there might be agitation, and other things that come with hyperthermia. Juan, you could go on to the next slide. So some of the mental and and behavioral warning signs is that in addition to someone becoming addicted to methamphetamine, people who use methamphetamine long-term may also exhibit symptoms that include significant anxiety, confusion, insomnia, mood disturbances, which is what we said a little bit earlier, but also violent behavior. So they may also display a number of psychotic features, which includes paranoia, visual and auditory hallucinations, and delusions. For example, one of the more common things with methamphetamine is someone saying that they feel like there's bugs crawling under their skin, or they start picking their skin, for example. Psychotic symptoms can last for months or even years after someone stops using methamphetamine. And also, if these psychotic symptoms have already started, once the person starts to feel a large amount of stress, those psychotic symptoms can actually come back. So the spontaneous recurrence of methamphetamine psychosis in people who use methamphetamine and have previously experienced psychosis. So if they've already experienced psychosis and they're in a high stress situation, they might experience that psychosis again. And then the last slide, Juan, the next one over, it's going to have some other warning signs to look out for. So just immediate changes in behavior, staying up very, very late, which we already discussed, obsessive behavior or even obsessive thoughts, like maybe compulsively cleaning something, or maybe scrubbing the bathroom floor with like a toothbrush or something like that. Excessive cleaning, but also excessive filth. And because methamphetamine is an illegal substance, most of the time it'll come in little unmarked wrappers. So if you're seeing a lot of plastic wrappers, or if you're seeing a lot of like small ripped bags, then that might be an indication of methamphetamine use. Also broken and burnt glass, because the pipes that methamphetamine users use are like delicate. They tend to break. Secretive behavior. If someone is if you're concerned that someone is using methamphetamine and they become very secretive, it's just another warning sign to look out for. So it's a sudden change in friends. If they used to hang out with one friend group and now they've completely avoided them, or if that friend group is like avoiding their calls, or they've looked for a different friend group, something could be going on. Also avoiding your look or your stare, like a guilty look, skin picking and skin itching. And also, if they're not immediately like picking their face, you might see sores on the face, and also you might see sores on the legs or the arms. So just because someone has no sores on like their face, that doesn't mean that they won't have any sores on like their legs, or they won't have any sores on like their hands or their arms. And also, because methamphetamine tends to dry out someone's mouth, they'll get what'll happen is that their dental health will get progressively worse over time. So that's what's called meth mouth. And what happens is that people's gums dry up and then their teeth start falling out, just because they're using drugs. Juan, if you want to, so those are the warning signs to look out for methamphetamine use. If you guys have any more questions or anything about that, you can go ahead and type them. Without further ado, here's going to be Juan, and he's going to tell you guys a little bit about warning signs of prescription pill addiction.
Thank you, Julian. So, warning signs of prescription pill addiction. I'm going to talk about on this topic a little bit more aimed towards the youth, where we've seen the increase of exposure in the youth to prescription pills, and a little bit more on the over-the-counter also, because they both correlate. These medications being found in our cupboards and our homes, seems like the youth, through a little bit more on social media and maybe the exposure of music, we've seen a lot that individuals know a lot of prescription pills and what they are. Just me and Julian were presenting this week at a local middle school, and surprisingly, 7th graders know some of these drugs, and not because they're using it. They might know it because of music. They might know it because one kid's like, "Oh yeah, Juice World overdosed and died," and just because of those news and how it's reported, for example, that artist died of an overdose, an opiate-induced overdose, and wasn't able to acquire the proper help on time. I mean, he did receive emergency services at the moment, but it was by far too late by the time he left. So individuals might know the drugs because of artists, the social culture and the music that's being published nowadays. So prescription pills, we're going to touch base on two. So the common over-the-counter pain medications, over-the-counter like Advils and Tylenols, and the opiates. And the opiates are very powerful pain medications that just until recently have been prescribed more and more, not just for palliative care or for major surgeries. They're being prescribed even up to like oral surgeries or like when you have fractures and stuff like that. So for pain medication, because they're such powerful chemicals that they're able to completely numb the individual from pain. They're even being prescribed for like back pains and of those sorts. So they're more commonly being prescribed now. And with that comes, individuals and the access to it, the youth knowing what, some of these pills are. Most of them wouldn't know what Advil and Tylenol are and their generic counterparts too, but they because of there's actually songs that talk about Percocets. There's songs that talk about fentanyl, how they talk and how they work and what they do to the body, to their numbness. Now, I did include Xanax in this one because Xanax is being pressed using fentanyl products or laced with, and fentanyl being one of the most powerful synthetic opiates. This penny is always used in our presentations just to show and amplify how powerful it is. It takes about 2 milligrams of fentanyl for the average adult. We're talking about adult to be induced into respiratory depression. And if the individual does not receive the proper help, which is usually CPR, Narcan being the chemical that counter affects opiates in the breathing response, then the individual will, expire, unfortunately. And that's where the issue lies with Xanax. Xanax is not a opiate, but because it's being sold and pressed, in people's garages and illicitly, clandestinely, it's being mixed with fentanyl and sold under Xanax brand. And that's one of the more dangerous parts when it comes to the youth, not being able to identify. There's actually some people when we've done questionnaires in high schools that they actually know how to tell from a real Xanax and a fake Xanax. And we usually talk to them afterwards and be like, how do you know? And, these procedures actually make sense. If I'm not wrong, one of them mentioned that, for example, if the pill doesn't break a certain way, then they know if it's a fake or not. So definitely some of the more powerful of pain medications being the opiates and the fentanyl that's being found in the streets. So some of the warning signs that you might be able to capture easily. This is a little bit more towards the youth. Changing behavior. We know our youth, if it's your kid or someone that you take care of, your guardian, you'll notice quickly the change in the patterns of behavior, including isolation. Aggressiveness could be a sign of withdrawal also. Grades declining are an excellent factor that can be easily gauged, if the individual is a B student and out of a sudden there's a C and D's in there. And I'm not saying that it's always possible, an individual's having a hard time in math, algebra, statistics, but if everything across the board is in the lower standards than what that individual usually produce, then that could be a factor. That could be a sign that something's going on. New friends can sometimes expose them also to these chemicals and drugs. Maybe someone introduced them to them, and they're just kicking with some new people. So definitely always paying attention to the individuals, to the kids, the warning signs will always be there. And some of these chemicals that we talked about, not only opiates, but also like meth and alcohol, there's always warning signs that that show up before the individual, how they were before when they were sober. So that kind of concludes the topics in effect with their warning signs. And now we wanted to talk about the hotlines that are available. We have the LA County Warm Line, that's a county sponsored hotline for mental health services. DMH Access Hotline, also the Trevor Project. These are 24/7 hotlines. There's always someone there to respond to crisis, California crisis, youth crisis line before. 24/7 services that are also available. And if you don't want to call someone, you can also text someone. The text LA 741-741, 24/7, it's open. There's always someone to respond to any questions that the individual might have, or the crisis that they find themselves in. The National Suicide Prevention Lifeline, important phone numbers that definitely we should have in our phones as a notepad or a picture. You never know when a youth might want to reach out to any of these services that are offered. Also, the LAUSD Mental Health Hotline is another very powerful tool that's locally based and funded by the Los Angeles Unified School District. And some of the other groups that maybe, unless you find yourself in recovery, you would have more information. But these groups are for the most part, very independent. Alcoholics Anonymous, NAs, Al-Anon. And we have Julian that could tell us a little bit more about, like, for example, what Al-Anon and their services are. Go ahead, Julian.
Yeah, so the top row are the anonymous groups. So that's going to be Alcoholics Anonymous, Narcotics Anonymous, and Crystal Meth Anonymous. So those are 12-step help groups. Normally they have meetings like every week. The way that you would go about finding those meetings is that, let's say you go on like Google, you Google Narcotics Anonymous meetings. It'll take you to a website where you can put in your zip code, and it'll pop up like a list of meetings. So from there, you're just going to look for whatever meeting is available on Zoom. In LA County, they happen to close a lot of these meetings physically, but they didn't close them like online. So all of these meetings have actually moved to Zoom, or they've moved to Google Meet or something like that. So they are still happening. So if you were going to one of these before and you haven't, because you haven't been able to, just know that they are available on like Google Meet or Zoom and all that stuff. And they are all still free. So the bottom row is similar, except that it's the Anon groups. So Alcoholics Anonymous is for the person who is the addict, right? And then Al-Anon is for the family and for the friends of the alcoholic. So if your family or your loved one or something like that, they have an addiction to alcohol, you would go to Al-Anon. And there you would meet other people who also have a loved one, who tell you how they're dealing with it, how they're going through it, how maybe they got through it, and you go and you support each other. And it's the same thing with Nar-Anon for Narcotics Anonymous. It's the family or the friends or the loved ones of the people who attend these anonymous meetings, and maybe they're having a hard time dealing with that. Alateen is a little bit special. Alateen is for mostly the kids. It's if your dad is in recovery and you're having a hard time dealing with it, you can go to Alateen and you can find support for yourself in Alateen. And there are people who go to Alateen who is like, maybe my girlfriend is using some narcotic or alcohol or something. So I'm going to go, but I'm a teenager and I'll go to Alateen. So there are some cases like that. However, most of the time it's the children of the addicts that go to Alateen. And that's a little bit about these self-help groups. If you guys want to go to another one of our, if you guys want to check us out on YouTube, we have a really detailed way of describing how to get to these Alateen and Al-Anon and Narcotics Anonymous meetings that we've gone through before. This was just a little bit to like mention if you feel like your daughter, your son, or someone is using these substances and you want to find help for yourself, go to Nar-Anon. If you want to find help for them, maybe you can go with them to a Narcotics Anonymous meeting. And it's all about reaching out and helping one another. Juan, if you wanted, or Steve or Juan, if you guys want to tell them a little bit about like our programs over at Phoenix House.
Mm-hmm. Yeah, definitely. So I wanted to mention a little bit more what Julie was talking about, especially COVID-19 and a lot of the services, you know, in-person services that were being offered. I think, you know, we've been talking with Julie in the group how a lot of the services are now virtual, in a sense has kind of created a new channel for individuals to find recovery. Maybe prior to that, they didn't want to come up to a facility. I personally think that, you know, facilities in my mind would be intimidating place to come seek help. And, you know, just the fact that they see my face, I think, you know, so I think COVID has changed that, and where telehealth has accelerated, and the availability of it is become a norm, you know, just like this meeting that we're having today. So imagine this meeting before, we probably would have had an in-person meeting in a room with a board, with a projector. And now we're still being able to convey the information, maybe even better. And just the availability for everyone to have the access to it, you know, in the comfort of your home, the comfort of your office, the comfort of your computer with a coffee next to you. And I think that is also very important, where these services, NAAA, Al-Anon, have also done the same thing. Like Julian was saying, you go to their websites, their Zoom codes are there. It tells you the time the meeting starts. Boom, you log in. You don't have to have your camera on and still be able to receive the services that they provide. So with the 12-step programs. So definitely, let's move on a little bit more to Phoenix House and our services that we have. We do have outpatient services. We are providing services to the youth from 12 to 24. And now we are also providing services to the adult community. So definitely, that's the phone number for Lolita Oatley that's in charge of the outpatient services. Amazing person, really easy to talk to. Don't be intimidated. Mental health, we have Jenny Sanchez, an amazing team of mental health practitioners, clinicians that are available to help. I know most of them. They're really cool, down-to-earth individuals that really care about what they do. We also have wraparound services, you know, helping the community, helping families, being able to make the changes amongst themselves and the kids that need the help. And we also have the amount services here at Phoenix House with the help of the Your Grant that we have available. So this next page has our contact information. Myself, Juan Jimenez, Sarah Green, the program coordinator, Stephen Flamenco, the prevention specialist, Julian Olmos, one of the presenters today, also outreach specialist, Claudia Buenrostro, prevention specialist, and Morgan Wallace, that's also here as a clinical trainer. There is QR codes on your right and left, and those QR codes, the right one sends you to an Instagram page that's ours and has all of the information that's any virtual presentations that we have going on, any for example events that might be coming up. You know, we have Halloween that's coming up also, and other events that are being posted there, and information for any other services that are going on around the community. We also communicate amongst other service providers. And we also have our Facebook page here. And going back to the Instagram, there's also information there for our YouTube page. We do have the YouTube page where most of these webinars are being published. And like I said earlier, I usually stop the recording before the questionnaire. So that's never published. So I'll stop the recording right here.